Hi guys, it's Rukosa the Boob Boss and welcome to Bumps, Babies, and Boobs. Today we are talking about naturopathic medicine. Now, one of the things that I've noticed in my practice is that I have a lot of babies that are starting to see NDs. And so I have a lot of mamas who are like, you know what, I want to go the natural way. I want to look into a more holistic way of taking care of myself and taking care of my baby. And to be honest, especially I don't necessarily know that we have naturopathic doctors in Zimbabwe, where I was born and raised. So the first time I started hearing about it was when I moved to the States, and I feel in Seattle we've got such a rich ND population. We've got Bastyr University, so obviously we have a lot of people who are searching out naturopathy. But what does it mean? What does it mean to you? Is it something that is right for you? Last week, I spent the whole week on Instagram talking about prenatal vitamins and why it's so important for us to be watching what we're putting into our body, especially if you're getting ready to have a baby. So I figured now is the time to bring in a naturopathic doctor. And not only do I have a naturopathic doctor, but I have one of Seattle's top naturopathic doctors. So without further ado, Dr. Nooshin Darvish. Hey, Dr. Darvish.
Hello, Ru. How are you? So good to be here with you.
It is good to be here with you too. In honor of you today, I like stripped off my face. I have no makeup on. I was like, I'm gonna be as natural, but a girl needs eyebrows and lipstick.
I know, I agree. I'm the same.
I
You'll
was
be
like,
beautiful inside out anywhere you are.
there you go. I was like, I've got to have my lips, but other than that, I was like, we're talking all things naturopathic medicine. And so I just want you to introduce yourself, tell our viewers who you are, and yeah, what is naturopathic medicine?
Okay, well, I'm Dr. Nooshin Darvish, and I have been practicing for almost 25 years. I'm a graduate of Bastyr University, and I'm the founder and chief medical officer of Holistic Naturopathic Medical Center here in Bellevue, as well as Holistic IV Lounge, which is a very exciting lounge to have here in Bellevue in the Seattle area. We're the first IV lounge open to everyone and anyone who needs a little kick and a little boost, a little rejuvenation, a little joy in their lives. They just come in for a little drip or a little vitamin shot. So naturopathic medicine is really the medicine of the future, I believe. You know, that's why I'm in it, right?
Yeah, way ahead of your time. I hear you. I think that's where people are going. But yeah, continue.
Yeah, so where I see medicine to be is a combination of Western, Eastern, natural, bioenergy, functional medicine, anti-aging medicine, regenerative medicine. And so that's what we do here. We really combine all of those different medical systems into one, because I believe that one medicine doesn't give us all the answers. Yeah. It's not 100% proof. So we really need a combination to get a better idea of the imbalances within the body, and then help the body rejuvenate, regenerate, and heal itself. Because the body is really wise, right? We have been given this beautiful, incredible engineer of a physique inside and out, and it has the capacity to heal itself only if we get out of the way and give it what it needs. So too often do we get into the way of our body, giving it toxins and chemicals and emotional and physical, mental, electromagnetic stressors, all sorts of different things that we give to the body. And this poor body has to deal with it all. So we have to kind of maneuver our way through this whole system and figure out what's taxing it, what's not, and give it the nutrition, the food, the herbs, the vitamins, minerals, emotional support, physical support, whatever it needs to balance it out and allow the body to heal. So that's kind of what I practice as a naturopathic physician. We are licensed physician in the state of Washington, so we act as a primary care physician. Okay. We go through 4 years of pre-med and 4 years of naturopathic medical school. The first 2 years are identical to regular medicine, which means that we go through all the physiology, anatomy, and neuroanatomy, pathology, all of those courses, and then we also learn about pharmaceuticals and minor surgery, except that we also add in all this other holistic aspects of natural medicine, which is things like homeopathy, diet and nutrition, vitamins and minerals, manipulation. Many people don't know that we actually do manipulate, just like chiropractors or osteopathic physicians.
Oh,
Yeah.
we did not know that.
Yeah, so we do a whole system evaluation and treatment. And then we refer to specialists if we need to for diagnostics and so forth. But again, oftentimes we just give the body what it needs and remove its obstacles to cure. The body has a chance to do its work and heal itself.
Awesome. I think one of the big things when I was talking to my patients and telling them that I was going to be talking to a naturopathic doctor, I had a patient who said to me, "Oh, they do voodoo medicine."
You know,
I don't know if that's how Dr. Darvish wants me to describe it, but I think there definitely is some mystery behind it, right? Because we talk about the holistic part of it and herbs and alternative medicine. And I think when people hear that, they're thinking, oh, it's not science-based. And I love the fact that you explained how you guys are trained, because it is very deeply rooted in science, but there's more to it than just that. So what would you say to somebody who comes and says, okay, Dr. Darvish, you and your voodoo tricks and your voodoo concoctions and your voodoo medicine, what would you say?
Well, actually, I'm very much left and right-sided brain. Okay, so I like to see science. I like to see laboratory tests. I like to see functional medicine testing. I like that part, but I also like the energetics of the body. It's very, very important to me, the emotional, the spiritual, the energetics. And so if we can combine those two into, which we have as a human being, right? We're combined. But if we can combine it in medicine, then we're more on the paths of getting the body to heal. So I don't call it voodoo medicine, although I know some people have that concept. But when they come in here and I'm doing a physical exam, listening to the heart and the lungs, looking in your ears, and running blood work, all the basic stuff that a primary care does. But along with that, we're specialists in chronic care. So chronic disease and cancers and anti-aging and hormone therapies and all of that. Then we're doing more specialty tests through certain labs. But then I'm also doing energetic testing, which means that I'm looking at the nervous system, reflex testing. We're looking at acupuncture points and meridians and all of that. And I see the whole body really connected. So it's not just about the right side of the brain. It's really the combination, because we are a combination of the right and left side.
Yeah, it's about the whole body. Just looking
at the whole body.
Yeah, looking at you in a holistic way.
Yes.
So we have a large population of either wanting to expect moms or currently expecting moms, recently delivered. What is the role of an ND, a naturopathic doctor, in pregnancy?
Well, I think that an ND plays a very big role in, first of all, preconception care. Mm-hmm. Okay, preparing the body. I wish, I have 3 kids. My oldest one is 22. My youngest one is 18. And I had just...
So not to interrupt. So you finished medical school at 1.5 and then had kids, what?
Thank you.
Seriously, like I am sold. I remember we were on a panel together at the River.
Yes.
And we were mentioning children in their 20s. And I'm like, trying to wrap it around my head, and you're like, you've been in practice for 20-something years. And I just remember you stressing how important it was about what you put in your body and what you do and how you do with your daughters.
Yes.
And how it's super, super important. So yeah, I really am intrigued to know more. And go ahead and continue. Don't mean to interrupt you. But
no, that's fine. You can interrupt me anytime.
You're amazing.
Thank you. Well, I practice what I preach. Really, I practice what I preach. And that involves not only diet and exercise and nutrition, all of that, but also meditation and attending to my spiritual health as well. So I think it makes a huge difference in the way the body ages. There's so much science now showing about the aging process of the body slowing down as we incorporate some of these more natural therapies of self-care. as well as service. I think service and giving to others is a huge component of anti-aging, because if it makes you joyful, it's going to reduce the aging or slow down the aging process. But anyhow, I was going to say to you, preconception is super important, because it's in that period of time that you are preparing the hormones, preparing the toxic level in the body. We want to reduce the toxicity in the body. As women get pregnant, the fat in the body gets mobilized as a source of energy for the baby, for the growing baby, right? So if that fat has a lot of toxins in it, chemicals or medications or pesticides or what have you, then as you get pregnant, the fat is going to get mobilized, and along with that is all those toxins. And so when those toxins get released, guess what? They go directly to the baby, right? Yep. They go directly to the baby. And so that baby is becoming more toxic than we would like. So preconception is very, very important. The majority of doctors, naturopathic doctors, do work with patients. We certainly do here in preparing the mothers for conception. Now, this also is truly important for men, right? The fathers to be, right? Because up to now, the research has always focused on preconception for the mother, but we kind of left the dads in the background, right? But the truth and the reality is that that embryo, when it's fertilized, it is a combination of the sperm and the egg. It's 50-50 of each. And along with that will come the toxins that the father is carrying and the quality of the sperm. So it's just as important to get to the father and prepare him, get him to detoxify, just we are doing that with the mother, as well as provide the optimal nutrition for both father and mother for before conception, so that once that baby is conceived, it's a much healthier baby. I was doing a research for another presentation I was giving on epigenetics and racism, actually, and transgenerational health. And what was really interesting is that the new research is looking at the preconception emotional as well as nutritional status. So they found that, for instance, when the mother is deficient in vitamin B, B12, B6, B complex, that baby, once born, has a higher chance of insulin resistance issues, diabetes, and heart disease, as well as depression and mood disorders.
Wow.
So this is really important for us to know as mothers to be. Well, I'm past that, but the rest of you who want to be moms, right? That it is really important to attend to the nutritional status of both parents, so that baby is healthy. Then during pregnancy, if you're seeing a naturopathic doctor who is dual licensed, I should say, in midwifery, and there's a few, not that many, but there's a few, I am not one of those, then that naturopathic doctor will attend to the baby and mother. If it's not a physician that is certified or licensed in midwifery, like myself, I tend to the mother as somebody else is attending to the baby care as the baby's growing in the womb. So for instance, if you come down with a head cold or a chest cold, or you've got headaches or leg cramps or back pain or whatever is going on during pregnancy, then we tend to address that from a holistic perspective, keeping in mind that there is a growing baby and we want to minimize any toxic exposure to that baby. And then postpartum is super important because especially if you're nursing, because the same thing happens is those toxins can get released into the milk supply and into the baby. And again, we want to make sure the mom stays healthy and that we're addressing the baby at the same time.
Okay. And we just have a comment on Facebook, and Malia says, just told my fiance it's time for him to detox. Now, I've been going on and on about this, and my husband's actually watching. So, Dr. Darvish, you're talking to my husband right now, and to Malia's fiance. So how is he supposed to be detoxing? what do these guys need to do? What do our husbands need to be doing? Especially, and we'll talk about, I also want to know what we women should be doing in general, especially as you get older. But yeah, what do our husbands? Mine is in his 40s. So
Well,
what does he need to do?
well, you sound like he's old. I'm older than that.
You don't look.
That's what you say.
I don't believe you. I need receipts. I need the receipts. Show me your ID. I need a date of birth.
I will send you my. How about if I send you my license?
I need your license. I really don't believe you.
From our perspective, we look at each individual very individually, very personalized therapies and detoxification. Some people come in here and they have a full mouth of heavy metals, amalgams, the silver fillings in the mouth, and they want to get pregnant. And this could be a man or a woman. It doesn't really matter if you're looking at the father or mother. But the metal in the mouth can be one of those major toxins that sits in the fat tissue and gets passed on to the baby through the placenta. It also goes through the breast milk. And so if somebody's coming in with heavy metals in their mouth, or they're eating a lot of tuna or canned foods, I want to get them off of all of that. I want to, hopefully they're coming in preconception so that we get a chance to send them to a dentist who does the removal of the amalgams correctly, and then detoxify them for the metals so that it doesn't go through the breast milk or through the cells to the baby. And it also keeps the sperm healthy. The sperm is, lives off of zinc in a sense. And zinc is one of those major nutrients that is used by the body to detoxify heavy metals and chemicals. And so if you've got a lot of heavy metals as a man, as a father-to-be, then whether it is through the mouth or through something that you're eating or drinking, or smoking, right? Because all of that is heavy metals and chemicals. Then you're burning through your zinc, and that's going to affect the quality of your sperm, which ultimately will affect the genetic material to the baby. Okay, and that goes for the mom as well. So it's very, very individualized. Other people come in here and they're relatively, healthy. They don't have any metals in their mouth. They're eating a relatively clean diet, but they're drinking the wine or alcohol, or they're involved with chemical exposures from their work or something. And so we want to make sure that the body is clean for at least 3 months before they get pregnant, both the father and the mother. Okay. Right. And then also getting them on organic foods, making sure that they're not getting chemicals through their diet, reducing the chemical exposure again to the cells. And so making sure they're drinking clean water, filtered water. They're eating very healthy organic food that's whole food based, because you know what? You're going to be doing that anyways during pregnancy. So you better get used to it now.
So how do you feel about electrolyte water?
The electrolyte water depends which one. Is there a specific one that you're thinking about?
No, I feel like it's a trend that I'm seeing more and more. And I've had a number of my moms ask me about either buying electrolyte water or getting the contraption that will turn your tap water into electrolyte water. So,
well, number one, electrolytes are very, very important because they are minerals, but you want to make sure that they're high quality minerals in the water. Sometimes they put very synthetic minerals and vitamins in there, and that's not doing much for you. In fact, if anything, it's adding more toxicity to the whole system, right? And that includes prenatal vitamins, by the way. Many of the prenatal vitamins have synthetic vitamins in them. And so when you're taking your vitamins, you think you're taking, I'm taking my folic acid and B and this and that, but really you're not getting much absorption of the nutrients, or you're getting extra toxicity with all the fillers and things. So electrolytes are really important, but they have to be good quality electrolytes. I like using plasma-based electrolytes that come from the ocean, from the Mediterranean Sea, and they're really powerful electrolytes. They actually come in little glass vials. They're called quintons. And I have my patients use those because it really hydrates the cells and it gives you the full load of minerals. The other way to mineralize is just to do Himalayan salt or trace mineral salt in water, in filtered water every day. And that's a very simple, very inexpensive way to mineralize the system and provide the body with all those electrolytes and minerals it needs.
Perfect. You mentioned prenatal vitamins. I just spent the whole week talking about prenatal vitamins. I've been trying out ritual vitamins, and they've been really big on, hey, this is the ingredients that we're using. This is where we're sourcing them from. And I've been trying to stress the importance of bioavailability.
Yes.
Because it has something in it doesn't mean your body is going to get that amount or any amount. And I love that you mentioned the synthetic ingredients and the fillers, because a lot of the medication and a lot of the vitamins that we take, every time a patient asks me about prenatal vitamins, and I want to know which one your favorite is, but every time a patient asks me, they're like, and I'm like, supplements, good supplements are not cheap.
Yes, yes.
You get what you pay for a lot of times.
Yes.
The best supplements out there are like the food that you eat. If you can really make sure you've got a good organic diet, then that would help. But what would you say, why are prenatal vitamins so important for women to be taking when before they're expecting, 3 months before at least? And what's your favorite prenatal?
First of all, let me go back to your question about the quality of the vitamins and prenatals. Vitamins, I like them in a capsule powder form. I don't like the tablet version. The tablets, they've gone through a lot more processing to make them hard like that into a tablet form. And if you throw it in a glass of water, it won't dissolve. But hey, you think you're going to dissolve it in your gut? Probably not. We call it the outhouse syndrome when you're taking those tablets, right? Because it goes through one end and comes out the other end. So I don't like tablets, period. Okay. Powders are much more bioavailable, especially if they're in capsule form.
Okay.
And I will tell you my favorite one is Vitanica, because it has very pure vitamins in it at the bioavailable quality. And it's got some herbs that help balance the body, the female hormones especially. So that's the one that I usually recommend. There's many other ones. It's just that I personally have been drawn to that one with my patients, and they like it. They don't have to take that many. Usually just one capsule with every meal, and that's sufficient. So, yeah.
Yeah, I know a lot of times the tablets are like horse's pills. Like just trying to swallow is an issue.
Well, it doesn't get absorbed. So one other thing with the vitamins, usually there's a few things I look at. First of all, I look at the fillers. If there's a long list of fillers, goodbye to that one, right? The next one I look at is I look to see what the B12 is. If it's cyanocobalamin, goodbye to that one, because that's a synthetic B12. If it says folic acid or folate, goodbye to that, because I really like MTHF or methyl tetrahydrofolate. Okay, so those couple of things give me a hint that this is a good quality vitamin, or it's more of a synthetic cheap. Because most of the vitamin raw material does come from out of the country, usually from somewhere in Asia. And so it is contaminated with a lot of toxins like lead. We tend to get the vitamins that are more European based or US grown or processed. And so they tend to be a lot more pure.
And that's so important. I don't think people realize that when they go in and they buy vitamins or supplements. It's just whatever I can get, right? Because it tells you.
Yes.
Reading labels, making sure you're looking for fillers, making sure you have a good understanding of the bioavailability and doing your research. One of my favorite places to get vitamins, by the way, is like Pharmaca. And just being able to talk to the pharmacist and say, okay, what is in here? And if you don't understand it, pharmacists are really great at being able to answer those questions.
Yes. A lot of the integrative pharmacies. So Custom Prescription is here. Clark's Pharmacy in Bellevue. There's a number of them. Pharmaca is all over. There's pharmacists, and they have a lot of higher quality products. We also have a whole supplements store here, where we sell only high quality European-based nutrients and nutraceuticals and homeopathic remedies here.
Oh, I need to come visit.
So you should.
I'm gonna make an appointment. I'm gonna make my
I'm serious too.
Preconception appointment with an ND so I can see what you guys are doing.
Well, there's two kinds of us here in this office.
Okay.
So majority, there's 6 of us here. 5 of us are covered by insurance.
Okay.
Just so that you know, the big insurance companies, Primera, and Regions, and First Choice, and all of those. Okay. If you have Kaiser, if you have an options plan, they will honor this. I'm the only one who's not covered. I used to be covered for 20 years, but then I went off of insurance because I do a lot of specialty care, so it's really not worth it. The insurance doesn't cover most of what I do anyway. So
got it. Yeah, insurance.
But the other doctors, yeah, great. You can come and see the other ones if you have insurance. Otherwise, Rue, you can come and see me.
You better clear out your schedule for me. So that's good to know. So 6 providers in your office. 5 of them are covered by all the major insurances. Do you take Medicare, Medicaid?
Medicare, Medicaid doesn't take us. Let's get that straight, babe.
So we need to fix that, because honestly, I think if we're recommending less medications and less pharmaceutical options and really encouraging healthy diets, we just generally have a healthier population. So I would love to see that change. I'd love to see what we can do to get that to change.
I agree.
That doesn't seem right.
I agree.
But back to your practice, how has COVID affected that? So I want to make an appointment to come and see you. How's that working right now? Is it just virtual appointments? Can we come in? How is it working?
Yeah, so we have both virtual telehealth appointments and in-office appointments. A majority of our patients do telehealth as a consult. So especially if you're a new patient, they will do a consult just so that I can order blood works and they just go to the lab. I send it electronically to the lab. They go get that done. They get to know what I'm thinking, I get to know them. So typically the first visit can be telehealth. If there is a complex condition like cancer or autoimmune disease or something that needs to be seen, then we will see them in the office. And then follow-ups, they will come in typically as needed for follow-ups in office, and I will, or one of the doctors, whoever is seeing them, will see them in person. And then all our therapies are available in office. So we do a lot of vitamin drips, IV therapies, different nutritional drips. We have them for pre, post, and during pregnancy drips. So we do all of those. We do biofeedback therapy, we do acupuncture, we do spinal manipulation and craniosacral therapy and body work and injection therapies for various body parts. So all of the procedures and more, all of the procedures are going right now, yes.
Perfect. So tell me about one of the, you were so kind as to give away what our giveaway for today is the nano antioxidant therapy as well as the B12 therapy. So tell me a little bit, because I was like, nano who? Like, so
NanoVi.
What are we doing? Like, I was like, the nano 5i, NanoVi, like,
yeah.
And I was like, okay, what is Dr. Darvish on about?
I wish I was on the phone and I would have taken you over to the NanoVi room and shown you. But it is a small machine, and it's a European-based system. But it's a company that is from Seattle, and the studies have been done at the universities here. And they've done multiple studies on this system. Basically, it takes water, distilled water, and turns them into these very fine hydrogen and oxygen particles that we breathe in. And as we breathe that in, they've shown on multiple studies how it activates the antioxidant capacity in the body, but at the same time, the regenerative process in the body. Most antioxidants don't do both. So most antioxidants will activate the antioxidant, but they won't regenerate the system. And vice versa, regenerative treatments will regenerate the body, but they won't clean up the oxidative stress. So, but I want to explain to you what that means, oxidative stress and antioxidants, because we use those kind of freely, but most people really don't know what that means.
That's what it means. Yeah, go ahead.
So the way I like to explain it is using this analogy of fire. Okay, so you have fire. The fire is awesome, right? It warms you up. You can cook with it. It does a lot of things for you. But what it leaves behind is ash. And that ash is an oxidative stress. It's toxic to the cells and it's damaging to the cells. So when we are eating, exercising, thinking, sleeping, anything that we're doing, moving, anything that we're doing, every thousands of seconds, there is fire being made. That's one of the reasons we inhale oxygen. It's because our cells want that oxygen to build that fire, right? Oxygen promotes more fire. However, it also leaves behind ash. So if you are not on a very good diet, where you're eating a lot of food that's creating more ash, and you're not eating a lot of fresh fruits and vegetables that are antioxidant, then you are creating more toxicity in the system and creating more damage, which will lead to chronic inflammation and ultimately to chronic disease and cancer, right? So antioxidants are like the sweeper. They come by and sweep things that ash up. So antioxidants are usually vitamin C, E, and A, and fresh fruits and vegetables usually have those, and they help your body clean up the oxidative stress and the ash. But like I said, they don't cause the regeneration of tissue necessarily, right? So every second our cells are dying, and then the new ones coming. There's this all constant balance between cell regeneration and cell death, just like there is this balance between oxidative stress, the fire, and ash. There's a constant balance that's going on in the body. And so NanoVi is one of those systems that cleans this up. And it is one of the systems that we do during preconception and pregnancy, and then postpartum, to clean up toxins in the body and help the body regenerate, so that it's cleaner blood going to the baby through the placenta.
Oh my God, sign me up. So I will be in next week to get my...
Yeah, it's very easy. It's a 15, 30-minute appointment, and we have it in the IV lounge, and it's just a little nasal cannula that's connected to the machine. You just sit there and breathe it in. It's super easy. It's not invasive at all. And then the B12 injection, we only use bioavailable, natural, plant-based B12 injections. So we don't use the cyanocobalamin, which is typically what you find when you hear these free B12 injection. They are giving you cyanocobalamin, which, by the way, is over the counter in Canada. So if you ever want a cyanocobalamin, just drive over when the opens up, and you can pick it up without a prescription. But here, obviously, it's prescription, and I only use either methylcobalamin or hydroxycobalamin as an injection, which is a much more safer forms and much more bioavailable, and it actually helps your body detoxify at the same time.
Okay, so please make sure you're entering our giveaway. We're going to go ahead and put the link in the chat box. So if you're watching, make sure you're entering our giveaway, and we will announce the winner on Monday morning by 9 a.m. We'll announce the winner of the NanoVi and B12 therapy. So I know one of the images that you sent me, and I was like, what is going on here?
Oh, yeah, that's the image. That's the NanoVi.
Is that the NanoVi? Because I was like, okay, yeah. So what's in here?
You see this this bottle here, the little cup?
Oh, okay.
The purple cup in the back. Mm-hmm. Okay. I should have sent you a more focused picture than this so you could really see it. But this is water in there, and there is purple light that's going in there, and it's just bubbling. As it is bubbling, it is going through the system and breaking down into these nanoparticles that are then coming through the machine. And this thing here, this little tube, gets connected to a nasal cannula that you breathe through your nose.
Awesome.
So it's a very simple little machine, but it's a very powerful system.
And so non-invasive, and that's, I think, one of the things that I love about what you're doing is a lot of naturopathic medicine is non-invasive. We're not doing anything outlandish, anything crazy. It's just
Yeah.
how do you bring all the things we get from the environment and introduce them into your body in a healthy way.
Yeah.
And I definitely love the fire analogy for importance of oxidative stress on your
Yes.
cells and the aging process.
Yes.
So the IV lounge, I remember at the Riveter, you guys had just started. I think you just launched that over a little over a year ago. So
Mhm.
how is that going? What does that involve? Because when I heard it, like I was like, okay, so I needed this in my 20s, right? And I
We have anti-aging IV.
that is the IV that I needed. I needed a banana. So I was like that person who was, I had fun. And I was thinking, oh, so you have a banana bag lounge? But that's not, there is that for our partiers out there.
Yeah.
But that's not what it's about. There's so much more to IV therapy. So tell us about your IV lounge.
Well, the IV lounge is it's really a peaceful, joyful, rejuvenating, calm place, but it's very hip and very clean. Everything's white and not. It doesn't look sterile. It doesn't feel sterile, but it feels warm and clean, right? So we formulate. We have the only clean room at our clinic in the whole state of Washington, I believe. At least we were the second one initially, but the first office has closed since the COVID drama. So now we're the only ones who have a clean room. What that means is that we are functioning like a pharmacy, in that we have a huge filter in the ceiling. It's a very sterile environment. Nobody can go in unless they're gowned up and covered up with their shoes and hair and everything. And then they go under the hood and they mix these vitamins into a bag. And then the doctors will inject those. The chairs are zero gravity chairs. Some of them are full body massage chairs. And so you're sitting in a very relaxed position, letting the parasympathetic nervous system, your healing nervous system, calm down and absorb the nutrients better. You can go online and check out the IV Lounge. Actually, if you look up Seattle IV Lounge, Bellevue IV Lounge, it will all go to the same website. So if you don't know how to spell Holy Speak IV Lounge, you can just go to Bellevue IV Lounge or Seattle IV Lounge. And there's a menu. So there's a specific menu of vitamin drips and mineral drips. And you can pick those and book online and then come on in and get your drip. On this side, on the medical side, we have hundreds of different personalized IV therapies, anything from different types of oxygen therapies to vitamin, mineral, hydrogen peroxide. I mean, you name it. We have a lot of different IV therapies on this side that are prescribed specifically for patients for either anti-aging or chronic care or preventative care. But on the lounge side, people can come in and get their drips. And these drips are really, the ones on the lounge side are really good for almost anything. Actually, it's very surprising, but we get majority of our patients are athletes, professional athletes, or just athletes that are wanting to keep up with the vitamin burnout through their body with the intense workouts that they do. There is people that come in for beauty care, skin care and vitamin IVs that provide the nutrients that your skin needs. Some people come in for detox, just to get their body to detox, and those are specific nutrients in those. And then there is immune vitamin drips, which are aimed at helping support the immune system during infections and flu seasons, COVID season. So we get a lot of different people coming in for some of those. We also do NAD, which is an energizer IV therapy, and a whole load of other ones. But go on the menu at Seattle IV Lounge, and you'll see the whole menu, and you can check us out and enjoy.
Are any of these therapies covered? GJF Mathis wants to know, are the drips on the lounge side covered by insurance?
No, unfortunately, they're not, but they're pretty reasonably priced. So if you go on there, you'll see that they're pretty reasonable. They can range from I think it's $30 all the way to $350. Majority of them are between $139 to $150.
How often would someone need that? So for me, who's needing a prenatal detox, do I just get one and then I'm one and done, or am I going to be coming over and over again? Just from a sustainability standpoint, how does that work?
I usually recommend if you haven't really been diagnosed with anything or you're not working with anybody for a detox and you want to do a detox, we usually recommend one for every week or every other week for about 4 sessions. Okay. And then as long as you're keeping a clean diet and doing all that stuff. But if you're doing, for instance, a fat burning one for weight loss, then you might need it more frequently. You might need it twice a week for a few weeks or until you're getting the desired weight loss. So everybody's a little different. With the Energizer one, some people just with jet lag, for instance, they might just come in and get one after their trip or before they leave on their trip, and that's all they need. Or if they've got they know they're going to a party, or they've got a hangover, they might come in one before the party. Or they remember, oh yeah, I should have gotten that before I went, then they come in afterwards.
Got it. Yeah.
So it's different it depends what you're trying to achieve.
Okay. Tell me a little bit about the beauty treatments, because I'm looking at you, so I know you're obviously doing something very, very right with your 20-something-year-old children, which I still don't believe. I need my receipt. So,
thank you. You're so kind. That's why I like your roof.
Tell me about the beauty side of things. Because I know a lot of times we talk about, and this is something that I am not shy to say, vanity is very, it's a good thing in moderation. Yes. But it's okay. It's okay to want to look good, to want to feel good. And I think as moms, sometimes that's one of the things that we push to the side. And it's like, well, I'm a mom now. Yeah. And yeah, it's, what are we doing to take care of ourselves and, to have that glowing, beautiful skin? So what can moms expect to get from that, especially postpartum? It elevates your mood, feeling good, elevates your mood.
Really important, yes.
Yeah. So what are we?
So, beauty for me comes from the inside. So we first work with the hormone balancing and the diet and detox and all of that. But externally, there is multiple different things we do. So most people have heard about PRP injections, platelet-rich plasma injections. And I believe I was probably the first one to do that in this area, which was 2011 or something like that.
Okay, so a what injection? Because I'm like, what?
PRP.
Okay, so you're going to have
rich plasma. Okay. So what that means is we draw the blood, your own blood, and we spin it down, and then we extract out the growth factors and the platelets, and then we inject it back. And what that does is it stimulates the collagen buildup, tightens the skin, tightens the pores, gives you a really beautiful glow and a baby kind of a skin, fresh skin that can last for a year and a half, 2 years, depending on how you're doing with your diet and exercise. Okay, so that's platelet-rich plasma. We often add ozone to it. So ozone is a form of oxygen. And the reason I do that is because oxygen tends to activate these platelets even more. And it also acts as a disinfectant. So many places you may go to that do PRP may just take your PRP and inject it back. Well, I've had cases from other clinics where they've gone and they've ended up in the emergency room with a facial infection, skin infection, because their own blood had some kind of an infection in it. And so I always do the ozone to clean that blood before we inject it.
Is this an alternative to like Botox and fillers?
Well, I've never used Botox and never used fillers myself. So I do use this for patients instead of the fillers and the Botox. Because it stimulates even the growth of the lips and the cheekbones and everything, lifts the eyes. It's a very subtle facelift. It's a very subtle, natural. You don't look like you've had anything done. But they say, wow, you look so good, you look so young, you look so refreshed. But it's because these platelets are doing their work. And it's not an immediate treatment. It can take 6 weeks, 3 weeks, 6 weeks, 2 months to get fully activated, maybe even up to 3 months to get fully activated to get the results that you need. So we usually do it and you just wait for a year and a half, and then when you feel like you need it again, you do it. So that's one treatment that I do quite a bit. And we do that for the breasts, when after nursing your breasts sag, the saggy boobs. So it does give you a little lift because naturally we inject it and it gives you a natural lift without making you look too fake, but also not exposing you to all the toxicity that implants and the surgery can expose you to.
How much are you thinking about in terms of injecting? Because when you say, I mean, what volume are we injecting to give you that lift? Is there?
Well, you'll see actually when you inject that I'm injecting maybe about 12 cc's on each side.
Oh, wow. Okay.
Yeah, I'm injecting about 12 cc's. And then we also do it for urinary incontinence, postpartum. Most females have some kind of a urinary issue, or they lose their libido, or they have orgasm issues. And these injections in the pelvic area are really helpful for females. They're also good for men for their issues, but for females, it's really, really powerful. And they're called either O shots or V shots, and we do those here as well. So that's all the PRP stuff. We also do it in the joints for people with pains and injuries and tears and stuff like that. Then there is ozone injections by itself. So oxygen directly into the skin is really, really helpful. And that also gives you a rejuvenating appearance and makes you feel really good and makes you look really young. And then there's peptides. Peptides are amino acids that we either inject or give you orally to do or intravenously, and those give you building blocks to regenerate the collagen in your skin. So there's a lot of good stuff that we do.
Wow.
All aimed at stimulating the body to do the work.
I am loving this. I so many things that I didn't even realize that you offered, especially for our mamas, because I think I get a lot of questions about that. Like, what can I do? This is an area that I want to take care of, and it's nice to know there's so many non-invasive ways to snap back, to get our snap back.
I know. A lot of little secrets.
No, I am definitely coming in so I can.
I am holding you to that.
Next week, we're going to do a Facebook and Instagram live while I'm getting my IV therapy in the beautiful IV lounge. I'm going to make that happen for you all.
So I would love it. You will love it.
All right, Dr. Darvish. So are there any packages? I want to make sure that people out there watching, if there are any mamas to be right now, we're so limited in what we can do in helping people because of COVID, we're social distancing. But do you have any packages that, people can purchase for the mamas and papas? I think I'm going to get my husband a detox package for Father's Day. Happy Father's Day.
A lot of the IVs, we also provide them in groups of 4 or 5. And basically, if you purchase 4, you get a 5th one for free. Basically, that is the way most of those packages go. So you can order a detox of 4 weeks or 5 weeks and get the 5th one for free.
Love it. Love it. Love it. Can we mix and match?
Yes, as long as they're about the same pricing.
Okay. Because I think I'll only be able to get him in there once, and then the rest will be for me. I can drag him in there kicking and screaming, and then the rest will be for me.
And then there's combinations with the NanoVi as well, and then also hyperbaric oxygen therapy that we do here. So there's combinations of all sorts of different packages.
I could talk to you forever.
Yes, I could talk to you too.
I'm like, wait till the end to start talking about hyperbaric oxygen. Seriously.
Yes.
I need to have you back. But Dr. Nooshin Darvish, thank you so much for coming in and talking to me today on Bumps, Babies, and Boobs. Any final words, anything else you want to tell viewers about you, about the holistic medical clinic?
All I want to share is that the more you take care of yourself now, the easier it is to age. So do it before pregnancy, during pregnancy, after pregnancy, and with your babies, and It's going to be a lot easier to be a mother and a father to the babies when you're healthier, and the babies are healthier because of what you do. So I do think that this is absolutely vital, and it's a must for everybody.
All right.
Thank you so much, Ru, for having me.
Oh, no, thank you for coming. You can find out a lot more about Dr. The wonderful and refusing to age Dr. Nooshin Darvish and all her on holistichealth.com. They are in Bellevue. So if you want to go down to the lounge, make sure you call in. With everything going on with COVID, I guess people just need to call and make appointments.
Yes, and we make sure that they come in with a mask, and we take temperatures. We are spreading people out. So we're taking all the precautions possible so that nobody's exposed to anything that they don't need to be.
Awesome. And you can follow them at Holistic Naturopathic on Instagram and on Facebook. All right, Dr. Darvish, thank you so much for joining me. This was so much fun. I learned so much. I hope all of you at home learned a whole bunch of stuff as well. Join us next week. We're going to be talking to a chiropractor. And I know just like we've dispelled a lot of myths, and I'm hoping that people really do and will start appreciating the science behind naturopathic medicine, and that they are physicians, science-based physicians, but who are looking at the body holistically. And next week, we're going to be delving into chiropractic care and seeing how that can improve health pre, during, and post-pregnancy, as well as. So y'all have a good night, and we'll see you next week. Bye.
Thank you. Bye-bye.
Bye.